Sometimes you have fillings that are of a specific width or dimension in the tooth, or the way in which the filling is arranged in the center of the tooth or off center of the tooth. We have specific measurements and guidelines that are research-based that tell us when do we move from a filling to a crown, or when do we move from a filling to a partial crown. As I mentioned, we want to do the most conservative thing when possible. Sometimes we have to move to a partial crown or a crown. And when we move to something like that, most people are used to going to see their dentist for that procedure, and they know that it's going to take two visits. It's going to take the first visit where they prepare the tooth and give you a temporary, and then 3 weeks later you come back and you get your permanent partial crown or your permanent crown. At our office, we do it all in the same visit. It's all combined in the same visit in a shorter period of time. It's more convenient for people to come in for one visit and get that procedure done. We have a CEREC technology in our office. It's basically a CAD/CAM technology where we scan the tooth instead of taking those impressions that oftentimes we have people with gag reflexes. They have a difficult time with those impressions. And anytime they need a break, we can take the scanner back out of the mouth, and then we can go right back in and it re-stitches right where we left off. Patients appreciate that they don't have to sit there for minutes at a time holding this impression material in their mouth, and then it makes a mess. And we scan the mouth, we prepare the tooth, we scan it again. The computer knows the difference in what it has to, how it gets the tooth back to its normal shape, size, dimension, so that in the end, when it prints it out and we bond in this crown or partial crown, it's the same size, shape, dimension of the tooth that they had originally when they walked in that day. So, of course, when there's something wrong with the shape of your tooth, the way it exists, we make that change as well. But if there's not, we'll try to mimic exactly the dimensions of the tooth that you already had.